We're live.
All right, thank you, Megan. Good morning, everyone. It's 8:02. I'd like to call the February 23rd, 2021 Board of Health meeting to order. I am Deanna Diamore, the Director of Health. With me, we have Terry Quell, Norman Weinberger, and Vincent Amaruccio, who are three of them are all Board of Health members. We also have Megan Fogno and Teresa Argandesi, who are Norwalk Health Department staff members. Our first item on the agenda is the approval of the January 26, 2021 meeting minutes. Do I have a motion?
I move.
Dr. Weinberger moves.
I'll
Dr.
second.
Quell seconds. Any comments? Edits? Discussion? All in favor, say aye.
Aye.
Any nays or abstentions? All right, minutes passed. Thank you. Our second item on the agenda is public participation. In the interest of time, I would just like to ask anybody who would like to speak to try to limit their comments to 3 minutes or less. Do we have anybody who is here from the public who would like to speak?
Yes, we do. I'll unmute them now.
Okay. All right, I believe Ms. Laricella, you should be unmuted. Would you
Yes.
like to speak?
Good morning, everyone. We see soon that it'll get warmer out, and I know that will be a big relief to all of us. I thank you all for your work. I wanted to base my comments quickly on 3 things. The first is based on the minutes. I am very happy that this Board of Health is looking at and weighing in on important zoning applications and land use. However, I want to make sure, because my read of the operating budget, and I have discussed this before with the health director, I think it's very important to have subject experts available to you at the ready in order to provide neutral expertise to back up your good intentions about any land impact that could affect public health. And that is based upon what your actions were last month. It's good that this particular project was withdrawn. I'll just say that much to that effect. But I do think it's a good trend. It's just that you need neutral subject experts that are able to give you neutral evidence, not based upon your own proximity to a site or the opposition's experts, because it may or may not be correct or sufficient. Number 2, I asked that Teresa and Deanna Diamore look at the notes that Teresa took when she spoke with me about creative measures for mask messaging, especially with the double layer issue. It is, people are scratching their head, they don't fully understand, and they're exhausted. Lastly, the new vaccine policy that we all read about, with the governor changing up how he handles it by age. I look forward to a discussion, I hope vigorous today, because I just wanted to give you one anecdotal thing. Is I have a friend who is in charge of the transit workers in the Stamford Transit District. And apparently there were, in the New Haven Transit District, 40 workers that came down with COVID. And they're investigating as to the causation of it, either internally or because of their exposure to the transit riders. I just wanted to say that I think that this policy needs to be revised, not just by age, but also by their job function. So I look forward to the discussion about that, because it seems like we are opening up a potential unfair exposure route. So thank you for your work. Please take my 3 thoughts to heart and to head as far as policy. Thank you.
Thank you, Ms. Laricella. Is anybody else from the public would like to speak?
No one else right now.
Okay, thank you. So I see Lamont Daniels has joined us, Chief of Community Services. Good morning, Lamont.
Good morning, everyone.
And I know Ken is trying to get onto the meeting, so he should be joining us soon. All right, so the next item on the agenda is the director's report. So wanted to give you some updates. You might notice that we have another person on the meeting this morning who's taking meeting minutes from us. So we were able to find some funds in our budget to support taking minutes at this meeting, as well as at the Water Quality Committee and the Shellfish Committee meeting moving forward, to have that additional support to us for taking minutes. So happy to have that support. Also wanted to talk about just some of the additional funding opportunities that we're looking into. The state had reached out to us about some funding related to opioid prevention work. And so we're looking into that, and we're thinking about putting up a proposal together to bring some additional funding for opioid work. It would be for about over a year period. So we're looking into that to see if it's feasible. Do we have the capacity to do that? So we're looking into that, and we're also talking to Lamond about, community partnerships or other, folks in his department who can, help support that effort, working together on that. The other thing is we're looking into the immunization action plan programs at the state. There is the potential for additional funding to those that are providing those programs, and Norwalk has one for our region, to do additional outreach related to immunizations. So we're also looking into that as well. This is the last month, you may recall, of crisis funding that, good morning, Ken. Ken
Morning, sorry I'm late.
Joined us. So if you might recall, we got a little over $80,000 dedicated to us from the State Health Department, originally coming from the CDC to help with COVID-19 response. And this is the last month of that funding. So we're going to be expending the remaining of it this month. The past couple of months, we've been spending most of it related to overtime costs for the vaccine clinics and planning and coordinating. So we've been able to use that funding, and so a lot of our expenses have been reimbursed, at 100%. So that's been very helpful to us. And then I just wanted to mention the operating budget. So that's going through the process, and we'll be meeting, the BET does their departmental reviews upcoming. And so we'll be going over that. But most of the budget, the request for the budget for next year is related to some of the changes, improvements that we've been making, since the early retirement program, some of the staffing changes, which I'll be going into towards the end of the meeting. Does anybody have any questions or comments related to that quick update?
Tana, do you see additional funding opportunities coming down the line, or that FEMA's in the state looking at potential reimbursement?
Yeah, so we're looking into that right now in terms of, there's a lot more reimbursement potentially for immunization. So we're looking into that. There's a webinar that I'm going to be listening to in a couple of days about that, to think about, reimbursing some of the costs. We also have that epi and lab capacity funding that's goes until November 2022. And so we've been able to utilize part of that funding to fund a public health nurse. So we're using combination of per capita funding and that funding to get in a, to have an additional grant funded public health nurse who is going to be supporting the immunization efforts, as well as other, contact tracing and other efforts, as well as utilizing that funding for, the epidemiologists moving forward. So that's something we've been asking about, what other additional funds are going to be coming to local health now that the crisis funding has been, expended by the end of the month. So looking into that. Any other questions or comments? All right, the next item on the agenda is the COVID-19 updates. So there's a couple quick updates that I'm sure you saw from the CDC. I'm going to try to share my screen. Sec. Sorry, technology. All right. I'm going to try to show these slides. Can you see PowerPoint?
Yes.
Yep.
Okay. So there have been some changes in the past month related to quarantining and related to if you've been fully vaccinated. So I just wanted to highlight some of those. So for vaccinated persons who've had an exposure to someone with suspected or confirmed COVID, they're not required to quarantine if they meet certain criteria. So they have to be fully vaccinated, which means it's greater than 2 weeks following receipt of the second dose in a 2-dose series, or greater than 2 weeks following receipt of 1 dose. There's, the single dose vaccine. If it's within 3 months following receipt of the last dose, and if they've remained asymptomatic since the current COVID-19 exposure. So that's something that we've been adjusting, for contact tracing moving forward in terms of vaccination status. There is still the encouragement, of healthcare workers and others like within, like congregate settings, to be extra careful and to still need to quarantine. But for the general public, this is the new recommendations. We do get a lot of questions, just wanted to bring up related to the travel advisory. There's this perception now that if I travel and I've been fully vaccinated, you don't have to quarantine when you return. But the travel advisory for Connecticut is still in effect, and if you've been fully vaccinated, it doesn't change whether you need to quarantine or, provide a negative test result. It's something that I'm not sure if they'll change eventually, but as of right at this moment today, people who have been vaccinated, they're still need to quarantine after traveling. And the other thing I just wanted to bring up are some updates related to mask wearing and an MMWR that came out related to wearing masks. There's a lot of interpretation in the public, like double mask wearing, but this MMWR really focused on how can you wear a mask that fits tightly to really reduce transmission. So they've been looking at both a cloth mask over a medical procedure mask, and then looking at a medical procedure mask with knotting the ear loops and tucking in on sides to make it more fit, more closely. So a lot of our people that are working in our clinics are doing this now. They're putting the cloth mask over the medical procedure mask to provide extra protection. So I just wanted to point out some of the recent changes and updates from the CDC.
Is that what goes out to the general public? Because I know that's been a difficult thing for people to, all of a sudden think of they're thinking 2 masks. Oh my gosh, now it's hard to implement that. Mm-hmm. But is that the message that's going out from the department?
It is, and we've been, as soon as this update came, I contacted Josh Morgan, the communications manager for the city, and asked him to include it within, the daily briefing and the messaging. But, we can look to our social media accounts, and I agree, like the images I think are better and they're more powerful, and we should be pushing this out more. So we can look into that, into our social media as well. And I know, Teresa, you've been giving updates at community service provider meetings and other meetings Lamont has, and just trying to push out that message. I don't know, Teresa or Megan, if you have anything to add.
I think just modeling it. So like you said, at clinics, we're all wearing double masks, and people have asked us about it. And I just explained to them, even though I've been vaccinated twice, I'm already 2 weeks past, I'm still double masking to protect others as well. So just, leading by example always.
Thanks, Megan. Is this slide really small? I'm trying to see how you guys are viewing it.
Yeah, if you can make it bigger.
Is that better?
Yep.
Okay. So this shows the number of, I wanted to give an update on where we are with numbers. So this is showing, the number of COVID-19 cases by data specimen collections. This is by the week. So if you recall back in, the first wave, our peak hit, in April. And so over the summer we had, we had really few cases, but then our second peak for the state, the second peak really started in August, but in Norwalk, it really was more like September. You can see the peak week right around the holidays, right, at the beginning of January, but we are seeing the cases continuing to trend down. And so again, this is something we watch every week, seeing where the cases are trending down. But so this is just the latest showing where we are with the cases. So we're starting to see numbers, low numbers that we hadn't seen since October. So while the numbers are going down, again, we're still trying to push that message. We're still seeing numbers that, we saw in October. And so we want to keep them going down. We want to keep up the efforts with vaccination. We want to keep up the mask wearing, keep with, social distance, the physical distancing and all those to keep seeing the cases trending down. And then I just wanted to also show the test positivity. So over the summer, the test positivity was, below 1%. But this just shows, from the end of September on to where we are now. And so we had our percent test positivity was over 10%, and now it's down to 6.8. I'm going to be running the numbers again today to look at the past 2-week period. And we'll be reporting that in the mayor's briefing today. So we'll see where we are, but we are continuing to see the test positivity as well trending down.
Yeah.
Any questions? Yeah.
Yeah, I was just curious. The diagnostic tests, have they remained the same in terms of sensitivity and specificity, or have there been any changes to that?
I haven't heard of any changes.
Okay. So these numbers are just purely reflecting the number of, using the same diagnostic test, the number of cases that are testing positive.
Correct. Correct.
Thanks.
Have you seen an overall slowing of testing?
We are seeing in terms of, we're hearing from some of the testing sites that they're not as busy as they were at the peak, right around Thanksgiving, the holidays. But we are still getting quite a bit of testing happening and occurring. I can pull up the latest number of tests before we end the meeting today, and I can, the actual numbers, the denominators here, but we're definitely seeing they're not as, we're not seeing those long lines anymore, but we're also seeing testing expanding to a lot more different locations as well. But yeah, we certainly aren't seeing as many people getting tested as we did back in November, December. All right, so I just wanted to talk about some of the vaccination updates. So we're very close to having 3,000 doses administered by the Norwalk Health Department. We have another clinic today, so we'll definitely get over 3,000 with today's clinic's numbers. The state is providing information on vaccines by city and town. So it's really important to remember that all the different providers are providing vaccine to people from throughout the state. It's not really limited, it's not 3,000 Norwalk residents that we've administered doses to. It could be people from other towns, just like our residents could be going to other health departments. They could be going to the hospital and other providers for their doses. But as of last week, Norwalk residents, there were 8,817 people that had been administered their first dose. And we're just at about, under 10% of Norwalk residents that had their first dose received. I've been looking at the numbers, comparing it, to different towns and cities. And Norwalk is doing really well if you compare us to, similar cities and size towns. So we're really proud of the work that's being done by everyone who's vaccinating, and it's been a great partnership with the state to get this work done. We're really thankful to all our local partners who are helping in this effort. We've been providing clinics at the senior center. They've been amazing support as well. And our big focus right now is to look at additional community sites with the health equity in mind, and thinking about, how can we get into neighborhoods? How can we get into different parts of the city and provide testing opportunities for all our residents, and really thinking about, how do we make access better and how do we make it easier for folks to get vaccinated. So we've been doing some outreach and looking at different sites. Hope we'll have more to report next month on that. We've been making some great strides, thanks to Lamond and our community health workers, making connections to the faith-based community. We have some meetings scheduled, really looking at, how can we partner with them to increase vaccination within the city. Lamond, anything you want to add to any of that?
Thanks, Dan. I think it's just important that the key right now is education and awareness. I think that's the big piece. We have to continue to educate both those that are in influential positions so that they have the correct and accurate information to then share with those that they, those that are in the community, specifically our faith leaders. So, just to expand, we're really excited to be able to present to a fairly large interdenominational group tomorrow evening. And I think after we have this meeting, I'm hopeful that we'll be able to really do some targeted and focus community education awareness, but also actually opening up some sites in some specific communities where we believe would really be a game changer for us. So more to come on that, but everything looks promising and we're getting some good responses from the faith community that not only to be educators and influencers and messengers, but also getting them in a clinic to get inoculated. So we're looking forward to those strategies in the weeks to come.
Lamont, how are you handling or what's coming down the line with the J&J product? I've heard some different things about communities that want to make sure there's an option available to everyone. We don't want anybody thinking that it's an inferior product. So we need in the faith communities, are we getting that education started or thought about? Because I think that's going to be a challenge for all of us, making sure that people understand what the value of that product is.
Yeah, absolutely. And I'm gonna our lead educator, Teresa. Every time I mention your name, I give you another title. But really, Teresa has been doing a phenomenal job. I mean, she's really been on tour, if you will, in my opinion, literally. And I think that's the piece while we promote on our website, social media platforms, that is definitely a strategy. But I think the big strategy is in Teresa, Darlene, and Deanna and the team, we really have to do these group meetings and nonprofit meetings and, civic group meetings. That's the way people want to hear it. People want to ask questions right then and there. So that would be part of the cue our community hasn't talked specifically about the J&J product yet, Ken, but we know it'll be coming once it starts getting out there, but we're prepared to make sure we have the information and then really have those conversations. Teresa, I don't know if you want to add anything in terms of how you're thinking about promoting or talking about that.
No, nothing really to add, but it's a great point, Ken. It's something that we should get out in front of and let people know. I know I've had lots of conversations with people just in general that are, look at the numbers that they report on the news and have questions about, with how to compare the two or the three different brands. And I think getting that message out there that all of them are excellent options is really important to get out in front of. So that's a great point. Thank you.
More work to do.
But I wonder if J&J themselves are going to be putting out guidance, because you're going to have that situation in every state and around the world. So I'd be curious to hear from them too when it gets approved.
Absolutely.
So related to getting out there, getting messages across, Teresa, can you give just a quick update on some of the outreach that you have been doing? Because now that the state has opened childcare institutions into the next phase, do you want to talk about some of that outreach?
Sure. So we've been doing outreach in a couple different ways. So Darlene and I have joined a couple virtual sessions for employers and other specific groups like your early childhood care providers. We recently did one for a large social service agency that does a lot of home visiting work. We're kind of like Lamont said, we're trying to get out there and get the word out and just really answer people's questions. I think a lot of times they hear bits and pieces of stuff in the news or from friends, and to be able to dispel some myths, but also be there to answer questions. I think has been really helpful. So we've been doing that virtually. We also work really closely with community health workers at Family and Children's Agency. They, as you know, as I've reported in these meetings before, they've done a tremendous job helping us with contact tracing and connecting to community resources. And they have recently started shifting to a little bit more education and outreach in the community. So right now, some of their activities include kind of just hitting the streets with little packets of information, some hand sanitizer, and some flyers in different languages to get the word out to people and engage individuals in the community to distribute those materials, but also to answer any questions that folks might have. And then they're also assisting, reaching out to the faith-based community to make those connections and to try to help us understand who's interested and what kinds of questions folks have in that sector. And they're also going to start helping us at the clinics themselves with both language assistance and then, just having a community health worker there, to reassure people and to be there to answer questions. We feel like will be really helpful too, especially as people transition from first dose to second dose, or maybe we had a lot of people that come into the clinics and say, I'm trying to get my neighbor to come out, but they have these worries, gathering some of that individual information as well has been helpful. And so we're looking at doing more of all that variety of things. So individual and in-person, engagement, but also those virtual sessions for different groups to answer questions as they go.
Thank you, Teresa. I'm sure everyone saw yesterday the governor announced a change in plans for the next phases of vaccination. And so it's primarily going to be an age-based approach. They're going to be starting people that are 55 to 64, being eligible, and then they're going to move down to 45 and up, and then 35 and up, and then opening it up to everybody. But he's also, they're granting access to the vaccine for those who work in schools and childcare institutions. And the state health department held a meeting with us last night, and they're really looking at local health departments to be the vaccinators of schools and childcare institutions. And so they've asked us to get them updated numbers about, the schools and the staff within our jurisdictions, the childcare institutions, to start planning to see over the next month, how much vaccine we're going to need in order to vaccinate that population. And they have asked us to put a pause on some of our other plans so we could be the ones to be focusing on schools and childcare institutions. So we're looking at all that right now. And one thing I did bring up was, we have these plans to be out in the community and to reach members of the community that are facing health disparities. And you look at the vaccination rates and you can see the differences among race and ethnicity of vaccination status. And that's something that, we're really concerned about and we want to help address. And so we want to do both at the same time. We want it to be both. And so we'll be making that request to the state to give us, enough vaccine to be able to do both. I don't know if anybody else has anything to add or anything related to that, but that's the latest as of last night, what we're looking at in terms of vaccination over the next month or so.
I agree with you that the health equity issue is a real big deal. And by continuing to, you look at the groups that are coming forward, where it's not going to get at that population until we go out there and do that. Health centers around the state are in the same mode. We're looking at, let us test our patients. That's part of the community that is being underserved. And this doesn't necessarily solve that, an age band versus just a family. The problem with the health center is the family comes in and 1 out of 3 people is eligible, and it gets frustrating when you say, I'm right here, can't you vaccinate me now? So it's that the age bands don't lend itself as easily to the getting at the populations that are at biggest risk. But it's more. It certainly is going to add to the numbers. So.
Thank you, Ken. Anybody else related to vaccines? All right. So I wanted to give some updates on where we are with staffing, and I wanted to do it just in the context of, the city's reorganization, the community services department being formed, Lamont coming on board, just, the early retirement and the review that we did within the department about the staffing and the needs, thinking about the movement of Public Health 3.0, thinking about the community health priorities, thinking about reaccreditation and all our core functions and mandates. And so I just wanted to give just like a little background to this and just then present an updated org chart on where we are with staffing. Lamont, I don't know if you want to present this slide, but this is the latest for the Community Services Department. It's really exciting.
Sure. Thanks, Deanna. So you can see we're really, since the reorg, I think I've been here now, I don't know, it seems like forever. I think about 1.5 years now. So, my charge is really how to bring synergy and alignment to the many, which I call touch points of the city's specific departments. But we've also built and expanded. So in terms of an org structure, you can see the community services really being an umbrella, but the two main anchors are health and human services, which is consistent with most models from a locale or state, really building a health and human services department. So you all know what Deanna does, and she does a phenomenal job. But I don't know if you all are aware that we brought in actually Maria Escalera, who used to be the former director of operations for Norwalk Community Health Center. Well, we took her.
I did hear that, yeah.
Well, she's with us, and we're really excited to have her. So she's Norwalk's health, she's Norwalk's Human Services Director. And I think not only from her community health work and actually working in a clinic, she's been a definitely, added strength and asset to the work as we think about, not just our regulatory health, public health, but other things that we can do from a public health perspective. And then, my experiences coming from the foundation, looking at, the work through a social determinants of health lens. So we're really excited that we're, obviously COVID has really, that's our focus in vaccines. So, but, Deanna and I and Maria were talking that we still want to start building this new department, if you will, to how do we support residents, in the midst of the vaccine and all that is happening. So this just gives you an outlay of what that looks like, our thinking. Deanna will talk about the health department, but you can see under the human services, we're actually contracting services for senior services. The city will be actually producing the next RFP for the city's municipal agent for the elderly. That person will fall under human services, early childhood, which we already have. But again, bringing some alignment, we're actually re-envisioning the entire youth services department. And then, I'm not going to go over everything, but I think the point Deanna wanted me to share with you all is that how we're connecting, how we're aligning both the health department's role and priorities with the larger community service and connecting the dots for other services. So there's really this seamless way of we're interacting and working and serving the community. Thanks, Deanna.
Thank you, Lamont. So you're going to recall that, we had 3 early retirements, Director of Environmental Services, our Administrative Technician, and our Housing Inspector. We've since just newly hired a new Housing Inspector. She's joined, just started this week, so we're really happy to have her on board. But during the review, we looked at, these positions and, the Director of Environmental Services, Administrative Technician, the duties, and we've been revising job descriptions. And I'll go into that more later. I don't know if you all have seen the updated 10 essential public health services, but it got an upgrade this past year, and I really like these new updates. But you might recall that the state statutes charge every local health department to deliver the 10 essential public health services within their community. And now equity is front and center of this model. And this is really it goes into like a lot of the changes that have been happening, with accreditation and this, the different standards and measures, incorporating more of the health equity into the work. And so this is also something in my mind, thinking about, the future of the health department and where we're going, and, how do we continue to build on our equity work. Public Health 3.0. This is a lot of fun, like nerdy public health stuff, but over a few years ago, there was that new paper that came out that talked about where we are going with public health infrastructure, and how do we modernize it, and how do we improve it. And a lot of it is really looking at health equity and looking at, engaging multiple sectors and community partners in our work so that we can have that, collective impact. And again, a focus on that social determinants of health. One of the big charges for Public Health 3.0 is a strong leadership and workforce. And within that is this whole idea of a chief health strategist, a community health strategist, and how health departments play a big role in convening the community and working with the community to think about health in broad terms. And so, again, we keep talking about data being important. We need to look at different funding models, being flexible, looking at, sustainable funding or partnerships, and just, the infrastructure as a whole. And then also just thinking about, where we've come in public health with vaccinations and the improved sanitation and all the improvements that we've been making, but then thinking about, what are the threats that we're seeing now? And, some of the big ones are chronic diseases, thinking about all the, new and reemerging infectious diseases, thinking about vaping, again, the disparities and inequities, and then the big one, of course, is climate change. And so thinking about the functions of the Norwalk Health Department, seeing it as like 3 major areas with like 2 other areas being cross-sector and, supporting the entire department. So thinking about environmental health and all that goes into that, thinking about community health and really elevating that in the organizational structure, thinking about health equity, community engagement, community health improvement, thinking about, the work, health enhancement communities and others initiatives that are going on at the state level, and how do we support them and be part of that and lead those local efforts. And then of course, preventable diseases and disease control, the immunization work continues, our sexual health clinic and all that continues, tuberculosis case management and treatment, all the reportable disease follow-up, all of that work. And then thinking about really administration operational support, how we can continue to work across the department. So thinking about the different positions, thinking about the project coordinator position that can coordinate different projects across the department and fill different roles, based on the need at the time. Thinking about, all the fiscal and grants reporting that goes into bringing, the additional funding in. And then as we know, emergency preparedness can take, it could, it could be a pandemic, it could be an environmental, disaster, it could be a lot of different things. So thinking about those areas is really across the entire department. And so this is where we are right now in terms of the staffing. So we are transitioning that administrative technician into a health operations manager. And right now we have a draft job description. It's going through personnel right now. And hopefully we'll be able to fill that position soon and get it approved. We have added 2 new positions, the assistant director of health with a community health focus and the public health program assistant. But I'll just start thinking about, the director of environmental services position, again, transitioning that to an assistant director of health with the environmental health focus, thinking about that broad umbrella environmental health, thinking about healthy homes, thinking about, all the regulatory work that we do, as well as everything else, the water quality work, everything else that falls under environmental health, thinking about community health, and really thinking about that chief health strategist, that community health strategist role, that moving more towards that and really operationalizing that more and really dedicating, thinking about our resources that way to really have that true, community focus, working with, across the department as well. The public health program assistant at the top, that's another position that we're working on right now. And that position again is, is one that will be able to support a lot of different efforts. And I'm thinking about, different research needs that come on board, right? There might be an emerging health issue. There might be something that the community brings to our attention where we want to be able to do research, look at strategies, think about, evidence-based practices and approaches. And that's really someone that can help us with that type of work and provide additional support to us. And also, again, thinking about people that can fill different roles and support different efforts across the department. We've posted the assistant director of health position, both of those, they're posted. So we're going to be moving through filling them soon. We have the epidemiologist position that we're able to add to the grants union because of that additional funding. So that will be, it's guaranteed until November 2022. And as well as, combining the grant funding with some, the city's support for that. That also is, we've already received several applications for that position, and we're hoping to start getting, starting to do interviews soon for that. And so I know I'm throwing a lot out there. The medical biller, that's also a position that we had requested in the city's operating budget, and we're working with personnel to get that position filled as well to support the, generating additional revenue, bringing that into the health department. So the health operations manager is like very, much the, helping with budget and finances, counting, but then also thinking about the administrative support across the entire department and how do we best utilize it, and so that we can maximize, the capacity of all our staff members across the department. And we're also going to be filling 2 temporary contact tracer positions as well. So those are, I think, we're going to be interviewing for those soon. So any comments, questions?
A lot going on.
Yeah.
I just have a comment. In looking visually at this model, it's very apparent that only about half of the staff is city funded, and the rest is grant funded. And considering the amount of work that we do and the importance of this department, I find it really very concerning that half of the department is not funded by the city. I understand grants are really important and we obviously cannot live without them. And I'm looking, and only a couple of those positions are related to, the current pandemic. And most of the other positions are things we've been doing for quite a long time on grant funding. So next time we do a budget, I hope that we might consider asking the city to increase a couple of more positions so that we can have more solid funding in the future.
Thank you, Terry. I do have to, during the department review, we were able to add 2 new positions, and we were able also a couple of years ago, we're able to add the project coordinator position. So yeah, it's work to, over the past, we've lost positions, right? During the recession. And so now we're trying to build over time, more to, more investment into public health and into this department for sure. Anything else? Thank you, everyone. Those are the things that I wanted to review today. I don't know if there's anything else we want to bring up before we wrap up today.
I'd just like to give a big thanks again to all the staff who are working tirelessly 24/7 on weekends, on holidays, giving up family time. We really do appreciate all of your efforts.
Thank you, Terry. Yeah, the stat, I have to, like, even last night, I mean, we're like, we have to talk about the changes in vaccine. And so we're like, okay, meeting at 5:30, like that's, and the staff doesn't, they're all in, and they're, I can't thank them enough for all that they're doing. All right, thank you, everyone. Have a great day.